Gringle?
You can't turn your phone off. Oh, that's okay. All right. Good morning, everybody. I'm Eric Wiskus with Get Me Some Green. We have Katie McGee here today to talk a little bit about health insurance and what it can do for you and some of the changing things that are going on in the industry right now. So this is Coffee Talk on Saturday. So welcome. Katie, do you want to get started and tell us a little bit about everything?
Absolutely. So Katie McGee, I am with U.S. Health Advisors. So that is a private insurance company. So what I mean by private, just to kind of explain the difference between what I do versus a marketplace, Obamacare, ACA, which are three different names for actually the same exact thing.
Gotcha.
A lot of people are like, oh no, I don't have Obamacare, I have, an ACA plan. I'm like, same thing. So the difference between having a marketplace plan, which is going to be through the government, your Blue Cross Blue Shields, United Healthcare, Aetna, all kind of the big names that
the big guys,
right?
Through your job or whatever.
Right. They're going to be your group plans. A lot of self-employed will have to go directly through them.
Okay.
To get this kind of plan. But the big difference between private insurance and an ACA plan is the fact that we medically underwrite. Meaning that our plans are actually based on your age and your medical history as opposed to your income.
Gotcha.
Now, this variation as for what we base our monthly premiums on, if you are young, 20-something years old.
Of course.
Right, really young, 20-something years old. And you're going through the ACA, it's going to be based on your income. Now, maybe that's great because you just started working and, maybe you're making, $30,000 a year, $50,000, somewhere in there. And that's going to be great because you're going to get a government subsidy. So that's going to bring your monthly premium down way low. Okay. But let's say you're maybe a little bit more established now, you're a little bit more settled, and you're making a little bit more of an income, but you're healthy. Well, now they're going to jack your rates up because they're going to start basing it on income because they legally cannot underwrite your policy. So they have nothing else to base the price on except income. So it makes sense.
Okay.
Private insurance, we are going to medically underwrite. So we're going to use prescription history, medical history, and we're going to use that to do an approval or a decline. But because we're not basing anything on income, then it's solely based on kind of how insurance was originally meant to work, right? Based on your health. So they're called preferred risk plans. Okay. So imagine car insurance and you've never had an accident versus car insurance and you've had 3 accidents,
yeah.
Right? It works like that.
Okay, interesting. So someone being not very familiar with the health, industry or insurance industry and going into a job and applying for all that, what are some of those differences and kind of you had mentioned the private and the marketplace, and then is there like a business insurance as well that you can take advantage of?
So group insurance is 9 times out of 10 going to be an individual's best bet if their group is offering it.
Right.
Because they're paying at least 50, 60, 70% of your premium.
Sure.
So
when you say group, is that like when a company has 100 employees, 200 employees, so you get a little bit better rate based on that? At least that's what I'm kind of familiar with.
Exactly. Yeah. So for the employee, great benefits, usually great prices. The problem is, let's say that employee wants to bring on a spouse or a spouse and kids. Well, the employee is not required to pay as much for the family as they are for the employee. So then where it becomes expensive is trying to add a family.
Right.
So a lot of times what happens is I'll suggest employee, go with your group plan. That's great benefits, great price.
Yep.
But spouse and children, get them a private plan.
Interesting.
And you're collectively still going to save money.
Yeah, because now when you talk about trying to bring in the family and all that as well, and almost separating the two out, for me, I would think, oh my God, that's going to be expensive as all get out, right?
Right. Where it's actually the exact opposite.
And it's not like a Cobra type of plan, right?
No.
Like where it's just astronomically expensive.
Yes. So Cobra's it's literally meant to be a last resort. You've lost a job.
Yeah.
Some kind of, maybe they stopped offering coverage or you're no longer working there. They give you Cobra.
Yeah.
So it's going to be basically the same exact plan that you had while you were employed, and maybe you really love that plan, but now nobody's helping you pay for that, so
Right.
the rates are gonna drastically increase.
Gotcha.
So, COBRAs, as far as benefits, is not a bad option, but it is extremely expensive. The other misconception is that you can only enroll for health insurance during open enrollment, November 1st through December 15th. That is true if you're going through the marketplace ACA Obamacare.
Sure.
But with private insurance and some other short-term companies that are out there, you can actually enroll anytime during the year.
Okay.
So we do not operate under an open enrollment period, which is really nice.
That is nice.
Yes, so somebody leaves.
Because I swear I always miss that open enrollment piece.
Yeah, January, you have no idea. Everybody's like, oh, so I missed open enrollment. And I'm like, I got you.
Nice.
Yeah, so it's, that's another really big misconception, is that it is, you can only enroll in insurance during that one time of year.
Yeah.
So, a lot of people also ask the underwriting question. I thought that underwriting wasn't legal, it's not allowed, and the answer is absolutely right if you're going through the exchange. They have no pre-existing clauses, so they have to accept you at 100% no matter what.
Sure.
So pre-existing conditions, what does that mean? So we're talking major things, right? Cancer, heart attack, stroke,
Okay.
Diabetes, on back, neck, spine issues.
Things that would need to be like maintained as
right,
you're going
exactly.
through it. Yeah.
Ongoing treatments, upcoming surgeries, things like that.
Sure.
Everybody, at least somebody in the family, is going to be, on a cholesterol or thyroid or antidepressant, ADD medication, high blood pressure. All these things are standard.
Sure.
So a lot of people are like, oh, well, I broke my arm 3 years ago. That's pre-existing. I'm like, no, you're okay. Like,
Yeah.
You broke your arm.
Suppose it's healed, right?
Right. Full recovery, we're good to go.
Yeah.
So that's, I always tell people, I'm like, don't qualify yourself out before talking to a private insurance agent, because they're going to be the expert on that and tell you what is and what isn't.
Sure.
The other thing is, so maybe one person doesn't qualify, again, split the family. It's happening more and more. It's extremely common at this point. We'll write one person of the family on private, and the person with a pre-existing, we'll put them right where they need to be, which in North Carolina is going to be Blue Cross Blue Shield.
Really?
Yes, it's extremely common, and collectively with, the person with pre-existing on Blue Cross Blue Shield and the rest of the family on private insurance, they're still saving 30 to 60% as opposed to putting everyone on a exchange plan.
Sure. Facebook Live people, I wish I could have Katie in my back pocket every time I go to look at insurance stuff, because wealth of information. So without getting too political, obviously we don't want to ruffle any feathers.
That's fine with me.
But when you hear of all these like healthcare topics come up, as we get into like some of these pre-election stuff that's
Sure.
going on,
Yes.
I'm sure you're just biting your tongue at some things and cheering on others. Hopefully, some good, some bad.
Right.
What would be your ideal scenario for health insurance for the American people out there?
So, to be honest, everybody wants to be like, America's the only place that doesn't have healthcare figured out.
Yeah.
Right. Everybody else, they get it for free, and so on and so forth. And
They pay higher taxes, so the government or whatever is paying for
Right.
a lot of that. A lot of that happens in Europe, I
Right.
feel, like even Canada,
yes.
right? Yeah.
And why can't we get it right? Well, if you really look into it, that free healthcare,
Mhm.
you get sick and you need to run over to the doctor and, I don't know, pick up a Z-Pack.
Yeah.
Yet you have a 6-month waiting or 6-week waiting period. Well, your sinus infection is either gone or turned into pneumonia by
yeah,
now.
right, exactly.
So it has its flaws, right?
Yeah.
Here, you get a sinus infection, you can, I recommend you use a virtual doctor, because that's the best thing ever invented.
Yeah.
But if you don't have a virtual doctor, then you can run over to your urgent care, your CVS Minute Clinic, your general physician. I mean, you can just run in and have a visit if you need to.
Right, because that's always the big thing. You get sick, and then you're like, oh, I can't see the doctor until Friday, and it's Monday.
Right.
And by the time Friday rolls around, I'm feeling fine.
You feel fine, or it's way worse, and now
yeah,
you're,
yeah, or no, I can't get out of bed.
Right, exactly. So while in theory it sounds great, this universal health care idea, it has its flaws. So unless we find some kind of way that these other countries hasn't to fix that, that just isn't the route that America's ever going to go.
Yeah, I mean, I feel like there's got to be some kind of middle
in
ground
the middle, right?
In there somewhere, so,
I think where we're doing it right currently is the fact that there needs to be a guaranteed issue option. People get sick, and there's absolutely no world where a sick individual should not be able to get health insurance.
Right.
So there needs to be that option, which we currently have. There also, and it can be a little bit more expensive. Like, I understand the thought process behind that, because their care is currently going to be expensive.
Right.
But there also needs to be an option for the individuals who are very healthy, rarely use their insurance, never hit a deductible, that kind of individual or family, and theirs should be, again, preferred risk at a lower cost because they're not using it.
Right.
Now, whether that means so they have a high deductible, which a lot of people have the stigma of, oh, high deductible, this is a bad thing. It's not a bad thing. As a matter of fact, there's plenty of clients that I've encouraged to go high deductible. You're extremely healthy. You never use your insurance. You're not going to hit a $5,000 deductible.
Right.
So why pay for it? Go high deductible.
Yeah.
Have a lower monthly premium. But in the event that something major did happen, you still have the coverage there.
Right.
And
you might just have to pay a little bit more at that
time.
When something
right.
happens or
now,
something happens.
Any good agent, even with a high deductible plan, should have built in your supplements, your critical illness payouts, your excess accident coverage that are going to eliminate that actual high deductible out of pocket.
Right.
Critical illness payout, I never sell a policy without that on there. We've had 30-year-old clients have a stroke. It's awful. 30 years old, this is not something you expect. You also never expect to walk out the door and have a massive accident, right? So insurance is made for the things that you hope never happen, right? Yeah. Think about your car. Your insurance doesn't pay for your oil change, right? Right? So the maintenance things, while health insurance does have wellness and preventative benefits, really what insurance is for are the hundreds and thousands of dollars of bills for your massive heart attack, for your major accident. These things are getting ongoing care. Yeah. And I think the misconception is, well, I just want to pay for my annual physical. Well, your annual physical's, $200. And yes, while it has benefits towards that, that's a lot more affordable than your $200,000 issue. Operation or right. So there's nothing wrong with a high deductible for the healthier person. Keep your monthly premium low. If anything were to happen, all your supplements are built into there to actually minimize any exposure to your out-of-pocket.
One thing I guess that always kind of drove me nuts is being just self-business owner. Mm-hmm. We're not all there yet with all the insurance, just kind of starting out for small businesses. How does someone like myself go in and say, okay, what is the best insurance for me, right? I'm not with a big corporation where they're going to sponsor it. We just kind of talked about that. But what would be a good option for me as far as just trying to have coverage for myself and my family, sure. But
so
don't go broke.
So small business owners, independent contractors, things like that's really the bulk of my clientele. Right?
Oh, okay.
So that's generally who I am working with.
Right.
So the best bet for any small business, anyone who actually is really just paying 100% of their insurance out of pocket, that's not subsidized by either the government or an employer. Yeah. The first route you need to look at is going private, because it's going to be your most affordable option. And everyone in the family is generally healthy, and there's no reason you wouldn't be approved. Honestly, that's the route you should go. It's still very traditional coverage. Deductible, co-insurance, max out of pocket, all the supplements, guaranteed renewable. These plans can't drop you. So when I say that they are medically underwritten, you go through that once. Gotcha. Okay, I don't want to lead to the misconception that, oh, well, it's medically underwritten, so if something happens, I have to go through it again. Depending on the type of plan you're on, maybe if you went like a short-term kind of style, but if you go, catastrophic style plan, you go through underwriting once, right?
Sure.
So I would first recommend that small business owner talk to a private insurance agent. Go through the plan, through your deductible options, obviously get to a budget that fits the family, and then look at underwriting. Does everyone qualify? Yes or no? Yes, great, wonderful, let's make sure the budget's right and get you signed up. Again, one person maybe doesn't qualify, then what we're gonna do is we're gonna talk about splitting off that one member of the family and putting you in touch with a marketplace representative. That person's gonna take care of one individual, private insurance take care of the rest. I mean, at this day and age, splitting is the way to go if you have to.
Okay.
It really is. And while that sounds like, well, half the family's gonna have this plan and, one person's gonna have this plan, it's not nearly as confusing as it sounds.
Yeah.
I mean, it's all just one monthly draft, right? So it's not like, well, I gotta go pay this bill and now I gotta go pay this bill and who has. With private insurance, you also have a dedicated personal agent. Every single one of my clients has my cell phone number saved to their phone. They're friends with me on Facebook.
Right.
Clients text me and call me all the time. Hey, I got this claim, I don't understand, or I need to go to the doctor, can you find one in network, or whatever the question may be.
You heard it here, folks. You can find her on the Facebook.
Yes.
Sorry, go ahead.
No, you're fine. So, private insurance, it's very, very personalized you can build the policy exactly how you want, mix and match supplements, mix and match deductibles, co-insurance options.
Mm-hmm.
But at the end of the day, I don't expect my clients to remember every little piece of their policy 6 months from now when it's time to actually use it. So what do? They call me, Katie, this is happening. What is my plan cover? How does it work? What do I do? I sit down, pull it right up, and have the conversations where anything through the marketplace, you're going to call into a call center, you're going to sit, you're going to wait online.
And probably not get the answer to it.
Right.
Hey, good morning.
How you doing?
Good, how are you?
All right. Just coming to show you some love, show you some support.
All right, have a seat. We're live right now. I'm Eric.
Hey, I'm Bruce. Nice to meet you.
I
Nice
saw
to
you
meet you.
last, I was like, I know him. Do you live around here? You're awesome.
Yeah, like I said again, hey, you got to show love to the team. You know what I mean?
Yeah. Well, welcome.
Yeah, thank you, sir. Appreciate it. Ain't nobody show up yet?
No, we're just recording live.
We're live
instead.
on.
Oh, y'all are?
Yeah.
Okay, then. Don't let me interrupt. Keep going.
No, what? Do you have any health insurance questions?
Oh, no,
No. Okay. Good. Anything you think of, shout it out to me.
Oh, okay then. Well, I guess, by me, being new to the environment as far as, dealing with people, like, I would get, when I deal with more people I deal with, the more people who I would run across, who may be interested in, some of the stuff that you're selling.
Right.
Now, granted, we're not, interested right now, for my car.com company, you know what I mean? But, going forward, I still plan to put myself out in situations.
So, with that being said, actually, this would bring up another topic. Do you have through your company, do you have group insurance? Or is it everybody on their own plan?
Right now, everybody I think is on their own now. We're just starting up and, I don't have any, health insurance on myself right now. You know what I mean? But the reason why I know that. But like I said, again, it's kind of a crazy situation because I just I was laid off my other job, and I had insurance on that, and like I said, we just started. I'm like the main employee. Yeah. You know what I'm saying? And I think he has his own, his own insurance stuff like that.
So, small businesses with employees.
Mm-hmm.
So the business owner is not at a point where they're ready to offer a group plan. It is either unaffordable or there's maybe only 2 or 3 employees, so it really doesn't benefit them to buy. I work in that situation a lot as well. So what I recommend at that point, I'll go in and we'll have a conversation between the business owner as well as the other employees. And what's great is with individual or with private insurance, each plan is individualized and the policy owner or the applicant owns it.
Sure.
So the small business owner can say, I'm going to subsidize $100 a month for each of you to buy your own plan. They'll put it into a paycheck or however they want to do that. That's between them. But what will happen is I'll create plans for each of the employees based on what they need, and then if they were to leave, they just take it with them. So there's no COBRA. The business owner doesn't have to worry about setting that up.
Yeah.
the policy is using their routing and account number. So if they leave, the business owner literally doesn't have to do anything.
But they can continue on with their plan.
Yeah, the employee, if for whatever reason is no longer with the company, they just continue their plan.
See, that's awesome. See, I would think it would be a little bit more expensive though, too.
No, it's
Yeah,
still,
that's right. Yeah.
Not having as many employees, like
Right.
if you only have like, 2, 3 employees,
well, think about this. So you have a small business owner and he has 2 employees.
Right.
One's, 50 and has high blood pressure.
Mm-hmm.
The other one's 22 and perfectly healthy, never uses their insurance. But you're gonna get a group plan that is going to blanket cover these 2 completely different individuals. So 22-year-old healthy is paying the same price as 50-year-old with high blood pressure.
Mm-hmm.
Sure.
Where if they each have their own plans, 50-year-old with high blood pressure has a plan that fits his exact needs. 22-year-old perfectly healthy, I just want to go to the beach every weekend, has a plan that fits their needs.
Sounds
Right.
good. I mean,
Right. So now they're paying prices that fit their age and their needs, and the business owner they're each still just getting $100 a month for their whatever he feels like subsidizing.
Yeah, whatever.
So that's the option that small business owners that aren't offering group coverage because they only have a handful of employees really should go. Anybody with high turnover, maybe restaurants or bars or something like that, again, a great option because as soon as if the employee for some reason were to leave, they just take it with them. The business owner literally has to do nothing.
Except stop paying $100 a month, right?
Well, right.
Right.
So that's a really great option for businesses that aren't big enough to offer group coverage yet.
Right.
Oh, I like that option.
Yeah, it's a very, very cool way of doing things, and a lot of small business owners haven't looked into that.
A lot of because they're just so afraid that when they hear health insurance, they know that for them to get a good rate or something they want to deal with, they know they have to have a certain amount of employees.
Right. So obviously, the more you have, the
Of
better
course.
the rate's
Yeah,
going to be.
yeah.
But what if there's a situation where, ideally your company's going to grow to you have,
Right.
5,000 employees,
Right.
but there's plenty of businesses out there that aren't going to ever expand to that.
Right.
It's, maybe let's say a husband and wife realtor team and they have a secretary and 1 agent under them. And that's
Yeah.
all they want to grow to. The aspiration is not to grow to this, Keller Williams size company.
Mhm.
Right, so, and the other thing with the fact that we don't have an open enrollment period, we are year-round able to enroll people. When you have a situation where maybe you were a small business, but now you're turning into this extremely large company, you're rapidly growing, and it is time to look into getting legitimate group insurance,
Mhm.
there's no penalty or fee for canceling a policy.
Gotcha.
No matter what company you're with. I mean, it's, now obviously talk to your company directly and double check that fact. But, in general, most people are able to, that are not on a group plan, are able to cancel at the end of the month or, wherever their bill cycle is.
Right.
Okay.
Mhm.
All right, so you knew this question was coming.
Uh-oh.
How do you feel that CBD is now, and with some of the hemp laws and medical marijuana and all that,
Yes.
how do you feel that's going to impact, just the health insurance industry altogether?
Yeah.
Just for getting off some prescription drugs, getting off of the opioid
Right.
crisis that we have.
Well, as far as prescriptions go, the problem is going to be the big drug companies.
Yeah.
And wanting to allow insurance to start subsidizing or start paying for and having benefits for CBD because now you're going to take clients away from the big drug companies, right?
Right.
So that's really going to where you are probably going to see your big push of no.
Right.
Now, with that being said, where do I personally feel it fits in? I have multiple clients that are like, what are your holistic benefits on the plan? What are your, and
Yeah.
unfortunately, there are none.
Yeah.
Is the answer right now.
Yeah.
Nobody's offering it. Not even your ACA, Blue Cross Blue Shield. Nobody's offering holistic benefits right now.
Yeah, which I
it's-
think is kind of outstandingly wrong.
Well, right, because if you think about what if people were more holistic in their wellness, let's say, whether it's choosing to use CBD, acupuncture, you know,
Like therapy,
right,
here, yeah.
exactly, all the things you offer here, how less likely, how less often are they going to a doctor? How they are generally going to be healthier individuals because they're taking care of their wellness with in a holistic manner. So again, here you have the insurance company that's like, we love healthy people, right?
Right.
Low risk.
Mm-hmm.
You're not using your plan.
We're still
that
getting
much.
our money.
Right.
You're healthy.
Right.
There's nothing's leaving our company to go
But-
back to you.
Right. Big drug companies,
Mhm.
doctors, you know, and not even so much hospitals, but more like the practices are again where you're going to see the pushback.
Yeah.
Let me ask you a question. I was at I went to I'm just gonna say it like this. I'm not gonna say what the what the company was, but it was a CBD oil affiliate based MLM situation that was in Charlotte last month. I know you're familiar.
I'm familiar.
You know that their presence was here.
Yeah.
And I was in there, and because this is kind of directed towards you, but I was in there, and you know, their parent company is a company that sells quote unquote sprays that do they say that does phenomenal things. I know you're familiar where I'm going.
Sure.
You know what I mean? I know you know. And my question is the snake oil aspect of it, because that's what a lot of people. That's what you know. When I went in there, I like, because I could spot it. You know, I can spot it when I see it. You know what I mean? And you know, they had, you know, it was kind of like the Amway vibe. When I was in there, everybody, you know what I'm saying, running down the aisles, you know what I'm saying, preaching this, and they even had an old lady in the street with a walker come up and say, I use the sprays and it works, you know what I'm saying, I do this and I do that. My question to you, kind of directed towards you, is obviously you say your products are real, you know what I'm saying,
Sure.
But you have a lot of other products out there that, you know what I'm saying, that are maybe preaching that it does way more than it really does. And how does that affect you? And like I said, with health insurance, I know y'all also see that. And they see like, okay, then, well, this stuff, they say it does all these phenomenal things, but in actuality, it's just a placebo.
Right.
You know what I mean?
So you really need to know your source, and
Right.
that's when we first got started. That was one of the our big messages is just know the source of where it's coming from, know the company. Before we even started this whole thing, I had researched companies up and down every coast, every country, trying to figure out what some of the best ones were. I found CD Sciences. They were the first one that we signed up with and started doing wholesale with, like mainly online. This is like, pre-store, even, networking groups. We were doing all that.
Right.
And we chose them because not only are they kind of rated number 3 in the US, if not number 1 in some categories, they're a very pharmaceutical grade company, right? The most important thing is they're third party and sometimes even fourth party testing, outside of their own company. Like their lab's going to test everything, in their lab, but then they're getting it shipped out to have it third and fourth party tested, right? And when those numbers came back, they were 100% exactly where they needed to be, right? They claim what they say. Again, kind of very in that pharmaceutical health space, right? So they're looking to get it into doctors' offices. So I work with a wholesale, with a few chiropractors and physical therapists to get that product specifically.
Right.
And maybe not even all of it. My one chiropractor loves just the soft gels and just the unflavored drops because he knows exactly what's in it.
Right.
He knows exactly what he's giving his patients, and he can see the results, right? From there, we found a couple other companies that are local to North Carolina. So as we start to franchise out and maybe go to another state or up and down the coast, whatever it is, I want to pull in local CBD companies for that state or that city to get them. It's like, so, 3 of the products we have on our shelves are like literally right here in Charlotte.
Right.
A couple other ones are about an hour away, Asheboro, Conover. So we're trying to bring in that local aspect as well, but making sure they're still pharmaceutical grade and they're testing it. There was one doctor who was online and she did a video and she basically posted out, she went out bought products out of these 50 companies, and she went out and had them tested herself. Only, I would say, not even half were testing not even close to what they said they were doing.
Mm-hmm.
And I'm not going to say any of the companies,
Exactly,
names,
yes.
all that, but when I was like frantically looking on the list, I'm like, C Sciences, yes, 100%,
Right,
all right, great. And that makes me feel good. That makes my, doctors feel good. The vendors are like ecstatic.
Mm-hmm.
So you're not going to find that product in a lot of other like dispensaries or just smoke shops or wherever they're popping
Gas
up
stations.
now. Gas stations.
Yeah, that's the main, yeah. Mm-hmm.
So I mean, what do you want to buy your medicine from a gas station other than like aspirin, in those little travel
Right.
bags? You know what I mean?
Yes,
Like,
yes,
oh man, I got a
yes.
headache from driving too much. Yeah, maybe I'll do this. Or,
Right.
It's not really what I would want to do. And we get a lot of patients in here that are over 50, 55, 60.
Right. Mm-hmm.
They feel a little bit, they feel real comfortable walking into the space. It's, not overwhelming, that. So just kind of all those aspects tie in, and just knowing the source, I think, is really the biggest thing.
Right.
Know the company, know what they're kind of standing for. So I know they're like pharmaceutical. They flat out tell me like, yeah, we really just want to be in these types of environments. You know what I mean? So
I think that's the big difference, right? Is knowing who you're dealing with.
Right.
It all comes down to research.
yeah,
And in anything, I mean, I don't care what you're buying.
Yeah.
Research it.
yeah.
And the company or individual that you're selling.
Mhm.
So.
Or when companies go out and look for insurance, I mean, they're vetting 3, 4, 5
Yes.
different companies at a time.
Right.
I know, like, in a couple of my last jobs, I mean, it seemed like every year we're having a new insurance company,
Yeah.
because they find a better group plan or they find a better deal, or, the owner wanted life insurance too.
Right.
or
Well,
whatever.
that's the only one of the downsides of again, if you're a large company, group insurance is absolutely the way to go. But for small businesses with just a handful of employees, that blanket, we're going with this plan, everybody's going to get it, and this is what it is. You really have the employees have no options.
Right.
They're or they do. They'll pick like either you can have this deductible or this deductible,
Mhm.
and that's really it. Then, but they don't get to pick a network. So what if they switch and now their doctors aren't in network?
Yeah.
They're either
I've been
going-
through that. Yeah.
Right. So I posted a couple weeks ago, or actually it may have been last week, about the 4 different types of networks. You have PPO, HMO, EPO, and POS. And most people I talk to, a lot of my conversations are just simply educating individuals about what that means. They're like, oh, I have an HMO, and I'm like, are you happy with that? Well, no, none of my doctors are in network. I'm like, right.
Yeah.
You have one doctor, one hospital, and if you're not going to one of that person you were assigned, you're probably paying significantly more out of pocket. PPO is going to be your top of the line, right? Your unlimited networks.
Yeah.
Networks that are going to that can cross state lines. So one of the favorite features of our plans is it's nationwide.
Yeah.
So.
But you're going to pay more for it, right?
No.
Not necessarily.
No. Again, no matter which one of my.
Not even
plans-
being deducted out of your paycheck or whatever it is.
Yeah, I mean, again,
Really?
because it's simply based on your age and your good health. I mean, having a policy that's, if nothing else, simply just not based on your income, it's going to save you money already, right? I mean, when you go with a plan that's based on your income, unfortunately, the more you make, the more you're going to pay.
Right.
And if you're perfectly healthy, but you have, you earn a good living, you're almost penalized.
For being successful.
Being successful
Yes.
and being healthy.
Right.
Now, again, I would never put someone in a bad position. So if there's a pre-existing condition, that is the route that you need to go.
Right.
Because they're going to accept all pre-existing conditions. But again, if you're healthy, you're just throwing money out the window. But the other thing being, a lot of people don't know there is a private insurance option out there, that there are options based on your health, not on your income.
Right.
So even though we've been around for forever, we don't advertise like the way these Blue Cross Blue Shield, United Healthcare, Aetna, like these big brand names that because we are preferred risk and not everybody can get on a policy, we don't advertise.
Right.
So it is
But
very.
you're gonna be turning down more people than you accept.
Well,
Right.
and we don't want to, give off some kind of false idea about what it is we do. I mean, the reality is we medically underwrite, and that is what is going to give you a lower rate, right? But there are going to be individuals that don't qualify based on health.
Right.
So again, going back to your question of where do I think insurance is going, I would love to find a really healthy balance, and this is just a very realistic approach, because I don't want to say America will never go to, you know, free health care. It may someday. I think it's unrealistic, and I think if it does happen, it would be a very, very long time down the road before we found a way to make that happen.
Right, yeah, that's not happening.
But in the meantime, finding that balance between, you know, obviously the insurance company needs to get paid, the doctors need to get paid, the hospitals need to get paid, but pharmaceutical companies need to get paid.
Yeah.
But individuals and people need to have good health care. They need to be able to go to the doctor they want to go to. I'd like to see more affordable options through the marketplace that offer PPO networks.
Yeah.
I'd really like to see that. Most of my clients coming off of a marketplace plan, besides high prices, the other big complaint is none of my doctors are in network.
Yeah.
And you should be able to have the freedom, hello, we're in America, to choose your doctor, right?
That was not the job of my doctor. Well, when I was insured, my doctor, he switched. He was at Atrium, then he went to Novant.
Right.
And I'm thinking, like I said, I was under United Healthcare, and I think a lot of those, they paying, well, they were Carolina's Medical, well, that's what he said. You know, before they switched
To Atrium.
Atrium, you know what I'm saying? So United Healthcare, I guess, you know what I'm saying, want to do their business with, you know what I'm saying, Atrium, Carolina's Medical. But when they don't do Novant, because, like I said, again, their set of doctors or their hospital situation isn't with that. They don't have, I guess, a contract. Right. With, you know what I'm saying, that company. So when he switched, I knew that he was going to be out of, you know what I'm saying, out of service, I mean, out of network.
Right.
So I knew that, you know, if I still was employed by another person, I knew I would have to pay a little extra, because that's the doctor I want to go to.
Right.
So you're saying your company, no matter what, more than likely he's going to be under your umbrella?
Right. So the reality is that there's always going to be a handful of doctors who choose to not partake in a certain network. So I can't say every doctor, and you know,
but more than likely.
But yes, there's very few, and when I say few, I mean on one hand that I could count a client's doctor that hasn't been in network. And the reality is, if you are traveling on vacation or you travel for work, you need to make sure that your plan is going to cover you wherever else you are, whether it's vacationing in Florida or you got business up in Chicago.
Right.
You know, if you're traveling at all, make sure your plan is going to offer you benefits outside of your zip code, right? I mean, because a marketplace plan, again, rates, they ask you two things: income and zip code.
Right.
You know, so I feel I'd like to see some marketplace options become a little bit more personalized, where, you know, people can choose have a little bit more freedom in choosing their doctors and hospitals and things like that.
Sure.
At the same time, in saying that, we got to have different price points, right?
Yeah.
Not everybody fits in one budget. So, you know, the HMOs of the world, there's a place for them, right? Because somebody who maybe doesn't travel a lot, has a limited budget, are they really in a bad position on an HMO? They're like, look, I don't travel, you know, I really just want to go.
Boring life.
Yeah.
Right.
I mean, there's that individual, maybe they get a, you know, $150 HMO plan somewhere. You know, okay, great, but the family that is active, kids play sports, and I don't, you know, travel soccer, whatever. You know, again, you're up in Pennsylvania at a soccer match. You need to make sure your kid falls down and breaks their leg, and you have to run over to the hospital.
Yeah, you want to make sure you're covered.
Right. I think that network is extremely important, and the other extremely important aspect of health insurance is the supplements. You know, a lot of people are like, oh, I don't need a critical illness policy. You know, I'm not worried about cancer, heart attack, stroke, some kind of organ transplant. Okay, but you need to be, okay?
Right.
Because if you don't have a critical illness supplement on your policy, no matter, you know, a lot of times group insurance doesn't offer a critical illness supplement. If you're on group insurance, you need it. Like, go to Aflac or whatever and just get one. But with private insurance, all of that is built into the plan. So you have some kind of critical illness diagnosis. The number one cause of bankruptcy in America is medical costs.
Yeah.
Somebody has a major accident, they get diagnosed with cancer. I mean, these bills are hundreds and thousands of dollars. I'm sorry, I don't know about y'all, but I don't have just an extra hundreds and thousands of dollars sitting in my savings account.
Right. And not to spend it on that anyway.
Well,
Yeah.
And then you have people with a lot of assets. So maybe they do have a couple $100,000, but like you said, they shouldn't have to touch that to pay for medical expenses, right? So supplements are going to protect your assets, that you don't have to dip into savings, you don't have to go sell your classic whatever car, you don't have to go sell your beach house. So while supplements will, yes, they're going to increase the monthly premium. If it's important. I mean, because if you don't have it, then you're worried about the monthly premium, but something happens and now you just ran through your savings.
Right.
You know. So I'd say let an agent legitimately build a whole policy for total protection for you.
Okay. I love it.
Yeah.
I love it. Well, I think if you're good, I think we can wrap up.
Yeah.
But wanted to say thank you everybody for joining us
thank
online. Katie, do you want to give them some more information about where they can find you,
Yes.
who you're working for, phone number, website, anything?
Absolutely. So Katie McGee, you can probably the easiest place to find me, right, would be on Facebook. It's Katie McGee, U.S. Health Advisor. You can send me a message through there. Also, all my contact, email, phone number is on there. If you do want to shoot me, give me a call or shoot me a text, it's 704-763-8735. Or feel free to shoot me an email. It's Katie, Katie .mcgee@ushadvisors.com. You can find me. I'm on Pinterest, you know, whatever.
Yeah, we're gonna share this
Everywhere.
out. So wanted to thank everybody for joining us for Coffee Talk today. Have a good day.
Thank you.